Bugüne kadar vajinalarımız ve vulvalarımızla ilgili bizlere neler söylendi. Yeteri kadar ıslak değilsin, yeteri kadar kuru değilsin, yeteri kadar kılsız değilsin, çok kıllısın. Yeteri kadar güzel kokmuyorsun, neden çiçek gibi kokmuyorsun? Yeteri kadar beyaz değilsin, çok koyu renklisin, yeteri kadar simetrik değilsin. Çok darsın, çok gevşeksin, çok küçüksün, çok büyüksün. Tüm bu mesaj bombardımanı arasında doğru bilgilere ulaşabilmek için hazırlanan şahane bir kitap Türkçe'ye çevrildi. Dünyada birçok ülkede en çok satanlar listesine giren Vagina Bible'ın Türkçe çevirisi yayınlandı. Vagina Bible'ın yazarı Dr. Gunter belki bir kısmınızın takip ettiği bir jinekoloji uzmanı. Özellikle Twitter'da yargı dağıtışıyla bilinen şahane bir insan. Vajinalar ve vulvalarla yakından çalışan biri olarak kendi muayenehanesinde gördüğü, karşılaştığı yanlış bilgilere açıklık getirmek için Vagina Bible yazıyor. Pandemi döneminden önce gidebildiğim son konferansta Dr. Gunter'la karşılaştım. Bunu fırsat bilip kendisine bazı sorular yönelttim. Tabii ki bir konferansta olduğumuz için, iki arada bir derede böyle bir odada hemencecik laptopumu açıp çektiğimiz için çok uzun bir röportaj olamadı. Fakat elimden geldiğince sizlerden bana yıllardır vulvalar ve vajinalarla ilgili belki de en çok sorulan soruları derleyip kendisine sormaya çalıştım. Bu sorular birazdan göreceğiniz üzere özellikle vulva ve vajina temizliği ve vulvamıza ya da vajinamıza sürüp sürmememiz gereken ürünlerle alakalı. Bu konular söz konusu vulvalar ve vajinalar olduğu zaman hakkında en çok soru aldığım konulardan bir tanesiydi. Dolayısıyla vaktimi bu şekilde daha iyi değerlendirebileceğimi düşünüp bu konuları özellikle Dr. Jen'e sordum.
Hepiniz hoş geldiniz. Bugün 2 dakikalığına efsane bir insanı yakaladım. Dr. Jen Gunter, Vagina Bible'ın yazarı. Kitap çok yakında Türkçe'ye çevrilecek. Şu an çok az vaktimiz var. O yüzden hemen sorularıma geçiyorum. Hi everyone. Today I had the chance to quickly find Dr. Jen Gunter for like 5 minutes to ask her all of my questions. So before further ado, here they are. Okay, so before we start, can you please introduce yourself?
Sure. I'm Dr. Jen Gunter. I'm an OBGYN and author of the Vagina Bible and host of the TV show Jensplaining, which you can see if you're in Canada.
Okay, fabulous. And you're also known as Twitter's
resident gynecologist, exactly, and all-around badass.
Yes, agreed, for sure. Okay, so I have a lot of followers and viewers from Turkey. Some of the trends that I've been noticing for the past few years is around a lot of like labioplasty and vaginal steaming has becoming very popular. And also this like almost commercialization of specific procedures that need, you know, more they would need attention of a psychologist or a psychiatrist and a doctor, but these are being commercialized and being sold to women rather than doctors being like, well, all vulvas are different, all vulvas are natural, you know, unless you have these symptoms, then are these really necessary? So I just want to quickly ask about your take on vaginal steaming.
Sure. So vaginal steaming is not something that you ever need to do. It's based in sort of a historical patriarchal root of the idea that the uterus is dirty and toxic and needs cleaning, and it doesn't. Obviously, a fetus wouldn't implant in an embryo. An embryo wouldn't implant in the uterus if it was toxic.
Yeah.
So it's a very sort of old idea that has persisted in many cultures around the world because many cultures are patriarchal and have this idea that the lower and upper genital tracts are dirty. So vaginal steaming is not a thing. It can't help you with anything. There's a risk that you could burn yourself. None of these aromas or, steam is going to get in your vagina anyway. But if it did, it could potentially cause harm. The vagina is a no oxygen environment and, water vapor can bring oxygen in. So it's not helpful. It's potentially harmful and it's rooted in the patriarchy. So give it a pass.
Okay. And what about folks who promote the practice as like an ancient, feminine, empowering practice of like cleansing the body, increasing sex drive, diminishing, lumps or like signs of endometriosis. Even I've seen people promoting that for those purposes.
So I think that's terrible. It's misogynistic to lie to women about their bodies. And whether it's ignorance, the person not knowing themselves, or it's deliberate misinformation, I don't know. But vaginal steaming, first, can't help with any medical conditions. It just really can't. And, you know, if it could, then everybody would be cured of things when they go in steam rooms. I mean, you know, what's so special about squatting over something? You know, it's really not going to help with any medical conditions at all. It's not going to treat endometriosis. I've seen it advertised for postpartum depression. Yeah. I mean, and the harm also is that it can take women away from real things that can help them. Because a lot of these diagnoses that women have are scary. Maybe women have been disenfranchised by the medical system. They've been treated poorly. So this idea that it's a feminist thing will speak to them. And I can see how it does. Yeah. But it's actually anti-feminist. It's misogynistic to give women misinformation about their bodies. That's the patriarchy.
Okay, thank you for that. I think a lot of my followers will appreciate that too, because I do get a lot of questions about that specific practice. So my next question is about a more invasive and maybe more trusted, in quotes, practice, labioplasty. So I want to hear from you, who should be doing these surgeries, if at all, and who should be getting this surgery?
So labioplasty typically means reducing the size of the labia minora. Okay. And I think before we talk about that, we have to talk about what the labia minora are. Mm-hmm. They're the inner lips, and they're part of your sexual functioning. So they have specialized nerve endings you don't have anywhere else in your body. The labia minora actually at the top become the clitoral hood, and at the bottom become the frenulum and attach into the clitoris. So tugging on the labia minora is also part of the sexual response. Making the labia minora smaller is the exact same thing as making the penis smaller. And how many plastic surgeons would say to a man, we should make your penis smaller so you can look better in jeans? How many plastic surgeons would say we should make your penis smaller so you can look better in yoga pants? They would never do that. So you are actually saying you want to diminish the sexual organ for what? So to make it cosmetically better. Now, obviously it's your body and your choice, but I always like to remind people 30, 40 years ago, maybe a little bit longer, when I was a teen, a long time ago, I'm 53. So when I was a teen, we used to wear jeans that were literally painted on. You had to lie down because they didn't have spandex in them. You had to lie down on your bed and use pliers to pull the zippers up. That's how tight they were. And you know what? You could see the outline of our labia. That was kind of the point of wearing them that tight. Mm-hmm. People in the West often use the pejorative term camel toe, but I like to say labial cleavage.
Oh, that's
right?
So sexy.
We should, who doesn't want to have great labial cleavage? We should celebrate small breasts, large breasts. We should celebrate small labia, large labia, all different sizes, because if we all look the same, it would be horrible. It's great to all look different. So I think this idea that women are now distressed by larger labia is something that has become in the news because there's now plastic surgeons and some OBGYNs doing the procedure. They're creating a need where the need didn't exist before. And this isn't new surgery technique. This isn't like brand new things that have been developed. We've always been able to operate on labia minoras. So for example, I might see a woman who after delivery has one side of her labia that is 4 or 5 times larger than the other side. Mm-hmm. Now you could imagine how someone would say, listen, I kind of like to look like I looked before. Yeah. And so you can understand that. Someone saying, oh, I'd like to be in the ballpark on both sides. So we've always been able to do this surgery. We've just never advertised it to women as something that they should think about having. Mm-hmm. And the other thing that's really concerning for me is this is often advertised as something to treat symptoms. Large labia don't cause symptoms. I mean, there's a huge range of normal. There's actually some cultures that practice labial elongation. Mm-hmm. They don't have symptoms, right? So, and in one study from the United Kingdom, when they looked at all the women presenting for labioplasty, they all had labia that were within, 2 standard deviations of normal. They were all in the normal range. So this idea that large labia are causing irritation or itch, it's not the case. And people who say that there'd be other things doing it. So I don't mean that those symptoms don't exist. I mean, I would be able to come up with another diagnosis. Men are able to sit on scrotum and penises. Yeah. They don't have any problem. They can ride bikes. They can do these things. So the idea that labia that are 1 centimeter are going to get in the way, and a penis and scrotum don't. I don't understand that.
Yeah.
So this is all, I think, marketing to create a need. Now, obviously, it's your body and your choice, and there are many people who do very extreme things cosmetically with their bodies, and they get to do that. But you should know that when you're doing that, you're making the organ that's responsible for sexual pleasure smaller, and it would be the equivalent of making a penis smaller. And with that knowledge, if that's what you want to do, then it's your body and your choice.
Yeah. My biggest issue with this is that patients or women specifically, or folks who have a vulva, are not getting adequate information as to the variety of vulvas there are out there. So they have this assumption that it should look a specific way, and that is symmetrical, like inner labia smaller than outer labia, and that's not the case for a lot of folks.
Absolutely not. So 50% of women, so half of women, the labia minora are the same size or larger than the labia majora. They're visible. That's half. And what a lot of plastic surgeons want to tell people is that that's not normal. That's not, that's like saying everybody who's taller than 5'6" is abnormal.
Yeah.
I mean, it's ridiculous. My labia minora are longer than my labia majora. There's the Great Wall of Vulva, I think it's called.
Yeah, it's amazing.
The Vagina Museum in the United Kingdom's done a great job at, trying to promote vulvar and vaginal awareness. And I think this is one of the great feats of the patriarchy, is that they stop women having these conversations, right? Mm-hmm. That somehow it's dirty for us to talk about the size of our labia minora. We can talk about our bodies however we want.
Yeah, exactly.
And when we have these conversations, then we realize that this is actually all in a spectrum of normal.
Okay, thank you so much for that. And maybe we can, finalize our video. I know you have to go, with, if you could send one message to all of our viewers in Turkey and in Turkish-speaking parts of the world, what would your message be?
My message would be, if anyone says anything negative to you about you or your body, it's they who have the problem, not you.
Thank you so much for joining me today. Hepinize çok teşekkür ederim izlediğiniz için. Bugün Dr. Jen Gunter'la beraber çok hızlı bir soru cevap yaptık. Kitabı çok yakında Türkçe'ye çevriliyor. Bu konuyla ilgili sorularınız varsa aşağıda belirtebilirsiniz. Hepinize teşekkürler. Görüşmek üzere.
Thank you.
Videomuzu daha profesyonel koşullarda çekemediğim için affınıza sığınıyorum. Eminim vulvalar ve vajinalarla ilgili daha birçok farklı sorunuz vardır. Bugüne kadar kanalıma çektiğim vulva ve vajinalarla ilgili soruların linklerini aşağıda sizler için bırakıyorum. Ayrıca Martı Yayınları'ndan çıkan Vagina Bible'ın Türkçesi Vajina Kitabı'nı artık bütün kitapçılarda bulabilirsiniz. Onun da linkini ayrıca aşağı bırakıyorum. Vajina Kitabı, vulvalar ve vajinalarla ilgili, aynı zamanda üreme sistemiyle alakalı aklınızda olan birçok sorunun cevabını barındıran şahane bir kaynak kitap. Regl olmaktan uyarılmaya, ıslanmadan temizlik için kullanılması gereken ürünlere, menopozdan cinsel işlev bozukluklarına kadar birçok farklı konuyu tıbbi olarak güvenilir bilgilerle ele alıyor. Gerek sağlık çalışanı olun, gerek vulva sahibi, gerek partneri vulvalı olan bir insan bu kitaptan çok faydalanacağınızı düşünüyorum. Vajina Kitabı'nın ön sözünü sizler için yazmaktan büyük mutluluk duydum. Şimdiden iyi okumalar dilerim.
Mükemmel.